That's crazy. Hey guys, and welcome. My name is Dr. Nick Healy. I'm a chiropractor here in Winter Garden, Florida. I'm here with my patient today, Angelika. She comes to us with some back pain, so tell us a little bit about what's going on.
So basically, I'm a dancer, I'm a photographer, and just heavy lifting with equipment, also just taking class, rehearsals.
Okay.
So I've just got like a lot of back pain on the right side, and just don't really know how to address that.
Yeah. When did that begin?
Probably like 6 to 8 months ago. I noticed it just was persistent on that same side.
Okay.
But yeah.
Was there any instances of falls, accidents that you can recall, or it just gradually came about?
No, it just kind of gradually came about, and I just noticed that it was very much on one side, even though I didn't notice doing something on one side. So
Okay.
That's where I kind of started being a little more concerned with it.
Gotcha. And that's pretty typical. A lot of times we see with back pain that gradually comes on. There's usually not one incidence unless you slip on ice or fell down the stairs. Obviously, that would be a cause. But a lot of times people ask me, what causes this? And it's usually 1,000 little things that add up, and then someone picks up a shoe and their back goes out. Now, it wasn't them picking that up. It's just the gradual things of wearing down. And
Right.
your body can only take so much, and it's the piece of straw that broke the camel's back. So do you feel any pain going down the legs?
I don't know.
Okay, so what we're going to do an exam, and then we're going to do some treatment that might include some stretching, might include an adjustment, it might include some muscle work as well, depending on what we find. So first, let's check your range of motion. If I
Okay.
can, have you bend forward, touch your toes, or do the best you can. Good. Come back up, extend backwards. Pain with either of those two movements.
Not forward, but back. I do feel it on
Secluded to
the
that right side.
back. Yes.
Now, how about if you lean to your right side?
Nope.
Another side.
Nope.
Good. How about rotation?
Nope.
Okay, take a seat, face the front there. All right, I'm gonna put pressure down here. Let me know if there's any spot that feels tender. Any pain with that?
No.
Okay, good. Let's have you lay on your back. Perfect, relax your legs down. Bring this up here. Pain with that?
Not in the back. No.
Okay. There,
No.
here, or here?
No.
Okay, we're gonna put your leg at 45 degrees.
Okay.
Hold this in the air. I'm going to push down. You resist against me.
Mhm.
3, 2, 1. Okay, let's try that again. Okay. 3, 2, 1. Okay. All right. Relax this here.
Okay.
Just let this dangle here. I'm going to put pressure right there in that hip joint. Okay. And we're going to go back and forth 6 times.
Okay.
It's either going to hurt or it's going to tickle.
Okay.
So, and then we're going to retest it.
Okay.
Let this relax. Put pressure right here. And she's got a lot of flexibility. So we'll do all extension there. 2 more. Good. Hold it 45. I'm gonna push down, don't let me. 3, 2, 1.
That's a weird
Yeah,
and awesome.
yeah.
That's crazy.
Let's do the same thing on this side. Hold up, 3, 2, 1. One more time. 3, 2, 1.
I'm really trying, guys.
I know, I got you. All right, relax this here. Same thing, we're gonna do the same thing here.
That one hurts a little more.
Yeah. Like I said, you were tied down your left side.
Uh-huh.
Last one. Hold this in there. 3, 2, 1. Okay, sweet. So, you're strong. Obviously, you're a dancer. So your core is actually strong too, but you're just not using it as much. You're probably using too much of your back. And so that's why this left side is seizing, it's pulling, and you're feeling it more on your right side.
Okay.
So every single time someone comes with back pain, it's usually something different that's causing it. It might be the hip flexors, it might be the low back, it might be their knee. And although their knee is an issue, they manifest the pain here. So yours is what we're going on here. This is not firing, so when I put the pressure on and brought it back and forth, it told the brain, hey, these muscles can actually fire. And when that happened was, then actually fire those muscles, because you're strong. It's just your body's gonna do, it's gonna be in balance, like you said, and it's gonna compensate because it's lazy. So now we just have to work on, make sure that these are firing. Flip on your stomach. We're gonna start some treatment. This for you. All right, today we're gonna use a hydragun. It's for percussive therapy. I use this quite a bit on my patients. It's quiet, and it gets the job done. It gets deeper within the tissue to help break up any knots. And it's something you can definitely do at home as well. So, just give me one moment. All right, so the hydragun's got 6 speeds. I usually typically like to do it on speed 3. But it depends on how deep I'm trying to get. All right, so we're gonna work what's called the QL muscle, quadratus lumborum. It's a triangle muscle right here. As well as we're gonna work the top of the glutes into what's called the piriformis and the top of the IT band. And although her pain is on the right side, I find most of her issues are on her left. So what's happening is these muscles are very tight, which is going to shift those joints out of position and put more pressure on the right side, kind of just pulling it. Which in turn is going to create inflammation on that right side, and that's why she feels the pain there. But the actual problem with what's going on is on the left. Doing okay with this pressure?
Mm-hmm.
Now, as we go in the glute here and get the piriformis is very common, especially if somebody has any sciatic issues. In about 60% of people, that sciatic nerve actually pinches in between that muscle. So if that muscle's irritated, it can cause that pain to go all the way down the leg. And so true sciatica will go from the low back and go all the way to the back of the foot there. And so I'm going to have her bend her leg here. And we're going to rotate the leg to help rotate that piriformis underneath the hydragun to help break up any adhesions there. Doing okay with this pressure here?
Mm-hmm.
Good. Now we're going to go to the IT band. We're going to get the insertion where it's right at top of the hip. Now this IT band can cause a lot of low back issues, can cause hip issues, and cause knee issues. Very common in runners, dancers. Let's go to the other side here. All right. All right. I'm guessing this is going to be less tender as it was on the left because there's a lot more muscle spasms on the left-hand side. But we're going to do very similar things that we did on that side. Okay. And I typically like to go with the striations of the muscles. So I know that this QL is pretty much a triangle. So I'll go up here and then I'll get the paraspinals right along the edge of the spine. And as I'm going, I'm putting slight pressure on it. You don't need too much force because the gun does the job for you. How's this pressure here?
Good.
Okay. Bend this up. Same thing with the piriformis here. Okay, all right. Next thing we're gonna do, I want you to lay onto your back and we're gonna do some more stretching for you. Okay, perfect. All right. Okay. All right, first thing we're gonna do, I want you to bring this left leg up, stretch it. Tell me when you feel it.
Right there.
Okay, now I want you to push towards me. Okay, so we're activating the muscles of the hamstring. We're stretching those because they attach from here up into the pelvic girdle there. And that's going to cause some low back tension as well because it can pull on the bottom of it. So when I'm having her stretch, I'm having her activate the muscle to create blood flow. With blood flow brings nutrients, and that helps with any of the healing. Now, she can totally do this at home by herself. She can wrap a towel around here, pull it towards herself, and push against it. Good. And now we're going to rotate. We're going to get that outside of the glutes there. And you tell me when you feel it here, into that hip area as well.
There.
Okay. Now I want you to push up towards me. Good. And she's only pushing with about 15 to 20% of her strength. Just enough to activate those muscles. Good. Back to the first one. Tell me when.
There.
Okay, push towards me. You may notice that she went further the second time than she did the first. That's simply because the muscles are warmed up, the fibers have elongated, and now she's able to get an even deeper stretch. Good. And one more here. Good. Relax as you can. We can go a little deeper. There we go. And push up. Wonderful. Relax down. Same thing on this side.
There.
Okay. Push towards me. Okay. And I'm holding the stretches for about 15 seconds or so. Okay. Push towards me.
Is it okay that my bottom leg is lifted? Should I try to keep it?
Try to keep it down,
Okay.
so we'll just back off a little bit.
Okay.
And I can hold that like there. Good. back straight. Okay, push towards me. Good, and last one here. Push up. All right. So earlier we had mentioned that her core wasn't firing correctly, so I want to go through how to do a proper pelvic tilt into a proper bridge to make sure everything's firing correctly. So I'm going to have you bend both your feet, both your legs. Yep, perfect, just like that. This is something you can do at home. You can do it 30 times. You can hold them for about 10 seconds each. All right, so I'm going to place my hand right underneath here. I want you to do your best to rotate your hips and pretty much bring your belly button into my hand. Perfect, right there. We want to keep that nice and solid. I just want you to hold that for about 10 seconds. And she's not sucking in, she's rotating her pelvis to get her back flat against the table, which is going to, in turn, engage this lower core, which will take pressure off that low back. And relax. And engage again. Perfect, solid. So, all day I want you to have this pelvic tilt on. Okay. Now, you have to consciously think about it, but the more this is engaged, you walk around, it'll become second nature.
So
Okay.
even in other activities, you're saying try to actively think of this kind of rotation?
Yep, I don't care if you're doing photography stuff, you're out there, you're down like this, you're gonna engage the core. Because if not, if this isn't firing, your back is, especially if you're holding on to things.
And it's different than just like thinking of tightening. It's like you want that pelvic tilt.
Correct.
Okay.
Because that's going to actually activate here. If you just tighten, like that's not doing anything, and this isn't strong. You go like this.
Got
Those
it.
deep abdominal muscles are strong.
Okay.
Which will in turn take pressure off that low back. One other thing I want to do with you, because that's step one. I want to go do a dead bug. So Pilates, yoga are great exercises. So I want you to go up straight with your arms, bring your legs to 90, point your toes out, engage the core. Hold that for 30 seconds. So this is stage one of a dead bug. You starting to feel a little shake already.
Yeah, I'm trying to make sure I don't lose the engagement and get lazy and then use my back.
Yep.
Yeah.
Perfect. Because when you feel strong with that, then we advance the dead bug. And all she is just holding it. That's all she needs to do right now. And relax. Now I'll show you the next, another advancement. We'll just try it.
Okay.
Just so then they can see it. So come back up. Oops, sorry, not back up. Back to where you were.
Oh, here.
Here. Here. Engage the core. Now I want you to extend your opposite leg and opposite arm. Come down here. Good. And then bring this back up. Focus on engaging this and bring it back up. So now the same thing, opposite these two here.
I'm sorry, it's
No,
kind
you
of
got
a mind trick.
There you go. Push, engage this up here to bring it back up. Focus on firing that muscle. Same thing here. Good, that's nice and strong. Back up. One more. Good. And relax. It seems easy, but it's difficult.
It's just you have to get used to the opposite. But
Exactly. Okay, last thing we're going to do, we're going to get you adjusted.
Okay.
Okay? So we're going to start up top of the neck. We're going to get everything adjusted because what's up top can be affecting what's down below because everything's connected. So, okay. All right, let's lower this slightly for you. All right, first thing we move is this guy right here. I'm going to rotate. We'll bring all the way aside. Let the head is dropped. Good. And then right here, rotate. Bring all the way aside. Good. All right, let's have you lay it on your side facing me over here. Okay, we're going to kind of put you in a pretzel here. Going to rotate. Give yourself a hug just like this. Bottom leg straight. Top leg up. Rotate so you're more on this side. And we're going to come all the way close to the edge. You're gonna feel like you're gonna fall, I got you. Okay. Your whole goal is keeping that shoulder nice and relaxed. Breathe in, and all the way up. We're already getting some movement. Perfect. Switch sides, face the other way. Here. Rotate your upper back there. And rotate your hips. There we go. Same thing, keep that shoulder nice and relaxed. Try to calm this down. There we go. Breathe in. And all right, that's how you move. Let's get some more. Good. On your back again, please. Here, I'm gonna get your ankles and your hips. I wanna put some traction in that lumbar spine as well. Relax your legs down. Do this right leg first. Keep this nice and loose. I'm gonna stretch it. Good. All right, same thing here. Perfect. All right, let's have you go under your stomach, please. Scoot down about 2 inches towards your feet. That's good here. You're gonna feel the table pop up and it's gonna drop underneath you, like that, okay? You're not gonna hear any pops or cracks with this. What we're positioning is this SI joint here. Good. Okay, now we're gonna get the mid back. Take a deep breath in. And all the way out. Good. Now we're gonna come back around this side. Breathe in. And all the way out, stretching it. Good, same thing here. Breathe in. And all the way out, this will be a little louder. Good, okay. Last one, I want you to sit on your butt and face the front.
Okay.
Okay, this one I call is the backpack. I'm literally gonna put you on like a backpack, stretch and pull, okay? Scoot back towards me. Put your hands behind your head and interlock your fingers. Perfect. Put one arm here, one arm here. I want you to put all your weight on me. Breathe in. And all the way, I'm gonna stretch it and there we go. Stand up, see how that feels.
Oh yeah. Oh yeah, this doesn't hurt.
Good, good.
Yeah, immediately, like that's like what I notice, like this. I don't feel it.
Good. Yeah, your SI joint was definitely out of whack, but we got everything put in line.
Yeah.
So you're gonna want to ice tonight. It might be a little sore, 20, 30 minutes.
Okay.
And then drink plenty of water.
Okay.
So otherwise, we'll get you back in here shortly. So
Cool.
appreciate it.
Thank
guys,
you.
Thank you guys, appreciate it. Make sure you hit subscribe below, and then we'll catch you next time.